Hi everyone, Monica Moore here from Fertile Health Expert. And today I want to talk to you about insulin resistance. So why are we talking about insulin resistance for PCOS? Insulin resistance is incredibly prevalent in women with PCOS, and in fact, many believe it's the culprit or the cause behind many of the negative consequences of PCOS, such as the excess androgens, such as the anovulation. So before we can talk about insulin resistance, let's talk about insulin and what it does. So insulin is a fat storage, it's a storage hormone, and its whole goal is to store fat. So if there's too much of it, or it's not used properly, you can imagine then that that person who has insulin resistance is at risk for more fat storage. The whole goal though for insulin is to pull glucose into the cells. It's the key to get the glucose into the cells, so to speak. So here is a picture of a cell. Let me see if I can get this better into view. Thing here. And these are little glucose molecules. And so they can't get into the cell without themselves. By themselves, they need a key. So insulin is the key that pulls the glucose into the cells. So obviously this is necessary because we need to get the glucose out of the bloodstream and into the cells where the cell can use it. The problem is when the cell becomes resistant to insulin, and we're not sure why that happens. There's some kind of like mechanism maybe that clogs here where the glucose can't get into the cell. The pancreas puts out more and more and more insulin. So tons of insulin. And what happens with this hyperinsulinemia is it will cause more fat to be stored inside the cell because of insulin being a storage hormone. The second problem is that even though there's more insulin, the glucose is not being pushed into the cell. So the glucose is sitting outside of the cell into the circulation where it can cause all kinds of trouble, as you know from people who have diabetes. Glucose, when it's inside a vessel, extra glucose, almost acts like shards of glass where it damages the vessel that it's sitting in. So it can damage that over time. So the whole goal with PCOS then is to become insulin sensitive, is to make your body more insulin sensitive. The first way to do this is lifestyle changes, what we'll be talking about. There's certain medications that you can take that make your body more sensitive to insulin, but that is the goal. So if you hear of insulin resistance, that's what we don't want, and insulin sensitivity, that's what we do want. So more on this to follow.